And joining us now in the studios, Dr. Jennifer Bryan, past president of Board of Trustees chair, actually, is the official title of the Mississippi State Medical Association. Just trying to get straight all the titles there, Dr. Bryan.
Health policy nut. How about that?
That's probably more appropriate. I know that, of course, from knowing you and you coming in on the show so many times, and also following your tweets on Twitter.
Yeah.
You tweet quite a bit.
Yeah, I enjoy it.
About that.
And thank you for that.
Yeah, absolutely. And so healthcare is complicated. Healthcare policy is especially complicated. I submit that I'm no fan of socialized medicine the way it exists in the nations that have it, where healthcare professionals work for the government. They're employees of the government.
Right.
That's a little different than, in my view, the distinction would be to those nations such as this, which have a lot of publicly funded programs for health. It's a little different. So what makes it complicated, and this is where I'm going with this, is that it's a hybrid. We have a lot of government involvement in healthcare delivery, healthcare coverage, healthcare regulations, but most of it is provided by the private sector. It's just a heavily regulated private sector. And that makes it totally complicated.
It is, and it's always going to be that way in some capacity. You know, if you want to have zero government-run health care, that ship sailed a long time ago. And I totally agree with what you just said. It's a highly regulated environment. You know, it is a hybrid, and ultimately it all comes back to the dollar and how we spend it and being wise with our money, because the health care is going to happen. You know, the patients are going to deliver the babies, as we're talking about right now. It's going to get paid for in some capacity, and so how do we shoulder that cost the smartest way? How are we the most responsible with our dollars?
I have a friend that I play golf with regularly. I won't say their name on the air. And I'm sure you know this individual, an OB, a practicing OB, that tells me that when he is on call, as they often are, of course, that's a baby can come at any point, right? So somebody's got to be ready. You can't say, well, I'll see you in the morning when that happens. Tells me that every year the state fair's in town, somebody's having a baby that works for the state fair and often have no insurance and cannot pay.
So, I was looking at some of that. I think we've got like an over 8% uninsured delivery in the state. So we talk about the Medicaid stuff a lot. I was just looking up stats, and I think that is not a number to sneeze at. Of course, a lot of these people are working, and that's the issue. You and I have talked a lot about how astronomical insurance is these days. We know that, and these are unique times we're living through, and the inflation is hard. And so really, when we talk about extension, we're looking at this eligibility period for these parents who we've delivered a child and we've arbitrarily cut them off at 60 days. And the 12 months there of the extension of eligibility time that we're talking about, you know, 1/3 of the mortality deaths happen after that 60-day mark. 1/3 of those moms are going to die, and we have one of the highest rates in the country.
Actually, it's the highest rate. I looked it up the other day.
And the highest infant mortality rate as well. So it's we are in a crisis, and how we respond to this is how history will look back and judge us. And I want to take just a second, if I could, and thank, you know, the leadership around the board who's looking at this, because everybody wants a solution to this problem that's workable. And you can definitely tell that people are reaching across the aisle. They're coming to the table and discussing it. And I just appreciate that, because, as you know, in Mississippi, medicine is big business. And when we talk about a $7 million cost to the budget, the latest numbers I had were from 2018, but just health care provided by physicians alone, and I'm not talking about other providers, is 7.8% of the gross state product, with $313.1 million generated in state and local revenue. When you talk about jobs and money, this is a big economy, and each physician directly provides 11 more jobs. And then when you look at indirect jobs, there's like 51,305 jobs in healthcare. I could go on and on and on about it. But when we invest in healthcare, the tax dollars come back, is the point.
Well, and those figures, Dr. Bryan, are consistent with the same composition nationwide. Mm-hmm. If you look at the composition of the amount of spending on health care relative to total U.S. GDP, the state is fairly in line with that, as are all the states, which I think you would expect. And, it feels like, well, that's one of those things you really can't do without. You don't really have a choice. If you get ill, you certainly have a choice over your lifestyle that may lead to illness and disease and so forth. But in a lot of cases, you don't. I mean, you don't do anything. It's just the way it is. We're mortals. Well,
and when you're talking about postpartum care, I think it's timely. We have talked about it for years, but we do have this pro-life focus now. And our moms really can't wait. I think that's the message that you hear over and over again. 53% of maternal deaths occur between 7 days and 1 year postpartum. We can do better than that. We absolutely can.
So we do have, in fact, Wallet Hub is an outfit that does a lot of surveys across the country, and they seem to be pretty reliable. I've looked at a lot of their surveys. They just completed one on the states that are worst for women. Okay? Worst for women.
Right.
No surprise, our state's the worst. And they report, and they include D.C., the 50 states, and D.C. is a statistical entity in the data. Woman's life expectancy at birth, we're 51st. 46th female uninsured rate, 50th high school graduation rate for women, 51st share of women in poverty. These aren't surprising statistics, honestly. And that, I don't know how that dovetails into the notion of extension of postpartum care. Here's what I can say, though, and ask you to weigh in on that. You cited some statistics about maternal mortality rates postpartum. And then I've also seen some that say, well, up to 88% of postpartum maternal deaths occur within the 60-day period of Medicaid coverage. Mm-hmm. And maybe somewhere in the middle. It depends on who honestly is compiling the statistics and doing the research. But I guess the bigger question is, to me, is that just the exclusive statistical metric? Are there other illnesses that a postpartum mother needs to be concerned with, or perhaps that are intensified as a result of just being pregnant and having a baby?
Well, first, thank you for that question. Absolutely. And I wrote one of my papers that I had to do to graduate residency years ago was on postpartum cardiomyopathy, which is something that we see often where they go into heart failure. But, I got to reading this week about crisis pregnancy centers, and shout out to them and the services that they provide. I think there's, again, depending on where you read, it's 31 to 38 across the state, which, certainly would not be enough we would want more, right? But as far as providing medical care, most of them don't, is my understanding.
Right.
Okay. And so when we're realistically looking at how we're going to take care of these patients, there's significant, up until 12 months, that's how the CDC defines what postpartum is, 12 months. We arbitrarily chose 2. So we've got 12 months, and you ask any mother that has been out there, it takes that 12 months before your body really gets back to normal. And that's where the benefit comes in proper spacing of pregnancies, making sure this mother is healthy for the next pregnancy. Because when you talk about the real cost of Medicaid, it takes one baby to be born with significant prematurity or health problems. Maybe a mother did not have access to care. And you are talking about astronomical cost of Medicaid. And when you look at, I think we've got over 4,400 preemies born statewide, and over half of these babies are on Medicaid. Millions 65%. And millions. Yes, millions and millions of dollars are spent. What was the number? Average, just on a regular birth, is $5,000 to $6,000 per birth. Approximately $1 million on the complicated one. So how many babies born with significant issue does it take to recoup $7 million? Not many.
Yeah. And it doesn't feel like, and we'll talk about this on the other side of the break, some of this financial and economic comparative data, I think, needs to be have greater relevance in the discussion as
absolutely.
well. I think that gets left out of the discussion.
It's a big part of this conversation.
Dr. Jennifer Bryan is our guest in the Element Well Studios. We've got Dr. Jennifer Bryan here in the Element Well Studios. Thomas and Greenwood, what prevents access to care for these women? What privilege do I have that allows me to provide for my own health care? It's not privilege, Thomas. It's just that you and I and Dr. Bryan and so many others of us are fortunate to have gainful employment where we are able to produce enough income to buy our own health insurance and have coverage for these ailments. There are a lot of folks that don't. I don't know if you've priced health insurance, if you pay attention to that very much. I can tell you this, Dr. Bryan, I'm approaching Medicare age, and because of my income, I got to pay the maximum for Medicare. After having paid into it for 40 years, it's going to cost my wife and I $1,500 a month for Medicare.
Yes, it's astronomical.
Nuts.
It really is a numbers conversation, which is why I'm glad our leaders are looking at this. We were talking at break about the number of preemies born in this state, and I want to double back on that.
Yeah.
Just the NICU at University, I used to describe it as looking like a football field of bassinets.
It's huge.
It's massive. And each one of those babies is ill. You know, they're fighting for their lives, and it just, you think about year long, those beds stay full, and they're not the only NICU in the state.
And I hate to interrupt you.
No.
For the benefit of our audience, that's neonatal intensive care unit.
Right.
You and I can talk about that, but some people may not know, and that's fine. And this is a blessing at the University Medical Center.
It is
a blessing.
Well, and all of us who went through medical school and training there rounded, in that space, so have an awareness. But you said that you toured it.
Blew me away.
Yeah,
changed me. Mm-hmm. I couldn't get it off my mind. I couldn't get I can still see it vividly today. When you walk in that room and you see all these human lives, tiny human lives, sick, with this army of dedicated medical staff, not walking around, running around. You've seen it. They literally run around. It's unbelievable, the energy. And they all got a smile on their face.
Yeah,
and they're taking care of these little people who are sick.
I had 2 preemies myself, but I will tell you that having seen those babies, particularly the ones that were really affected significantly, you're talking about lifelong expenditure, $1 million at the start, but it goes forward. So when you're looking to save money, we need to be proactive and not reactive. And maternal care, as you were telling me, was told to you that day by the leadership there. Maternal care can avoid so much of what you saw on that football field of bassinets of sick babies. There is so much that we can do to get ahead of this and save money if we want to work together on a solution that's real and not pretend.
Actually, she's not a doctor, I don't think, Rhino Getty Israel, that runs the Sisters in Birth organization in Jackson. She's been on the program a couple of times. She made a lot of sense, honestly, Dr. Bryan, and I wish we could get her more involved in this issue and maybe address our lawmakers, because what she said was so much of this is avoidable with just adopting good health habits before you get pregnant and certainly during pregnancy. And she has what she called experience-based, is that what she said? Evidence-based data that says if you just follow these guidelines, you're a whole lot less likely to have a problematic delivery and then problems postpartum. But apparently, her services are not eligible for reimbursement by any insurance.
But for those who are listening, and you may know, you may have been pregnant yourself or had someone in your family who's been pregnant, but that requires at least a monthly visit. And at that visit, when I did prenatal care myself with patients, we do that kind of counseling. And so physicians, we're used to that. We screen for problems, we catch them along the way. So, it takes all hands on deck, but I just want to point out that there's so many things that we can catch and prevent and treat and deal with when there's proper prenatal care in place. And then you asked about conditions postpartum, and I started with the heart, but I just want to say that I'd be remiss if I didn't mention postpartum depression. It's rampant, particularly in today's stressful times. Healthy babies come from healthy mothers, and it is a tragedy that we are arbitrarily cutting them off at 60 days. 12 months makes a whole lot of sense to return their body to that full normal state and to cover them through that postpartum period as defined by the CDC.
Right. Yeah, it's a complicated and it's a thorny issue, and I think you would probably share my view that we should educate the public more about, hey, before you get pregnant, start a family,
All of that.
you need to really think about the cost, the economic situation with that, and perform in as responsible, conduct yourself in as responsible a manner as absolutely possible. And so I would agree that we don't want to incentivize folks to get pregnant and start families by just doling out money. So I think education is certainly should be more in focus in that respect. But it is exciting,
the pro-life things that are moving forward with support of women and babies and children. And this is a logical look that we've been looking at for a long time. And it is not just about, although it is a good thing to do, it is very much an economic decision that makes a whole lot of sense if we can look at the whole picture of where money can be saved. And then also, this is our future. We invest in our kids now. It pays off long term for our state. And having a healthy mom is a big part of having a healthy 1-year-old that grows up to be a functioning and contributing member of society at 30. That's just, and I did hear a question this week about having access to health care. Does it improve outcomes? And I hope so, because that's my career. And we get them in and we make changes, and I see it every day. We come back, we've got a better blood pressure. We've got better sugar control. Their diet has changed. And yes, I mean, these pregnancies are in real time affected by that access.
Right. Well, I know certainly anyone that has the opportunity to see firsthand in person that NICU and then the more critical area. I'm not exactly sure what that carved out room was called, but it was for the more acute cases, the more critical cases, that you're witnessing a bunch of technology and a bunch of people using those tools to nurse these babies to health and to live productive, normal lives. It's incredible.
They're going to keep doing it, but it sure would be nice for those babies to be healthy in the first place and not need to show up. And I think the ask is, we've had so many leaders come out in recent weeks about this, is just to let the people have their say here. I hope that this will come up for a vote and that we can really get some traction and movement on this. That's kind of how our system is set up, and I hope that we're able to move forward with this and continue with the pro-life agenda with taking care of moms and babies. This just makes economic sense, but also just good common sense.
What are you hearing from the hospitals and healthcare providers in general with respect to just the shortage of personnel, talent? It's incredible.
It is, and I'm glad you brought hospitals up, because that's an entire part of postpartum care that would not be covered by our wonderful volunteer groups, although they do a great service. Staffing continues to be a challenge, but technology is improving, access is improving. We're looking at creative things like protocols in clinical practice to deal with some minor illness that, just kind of working smarter, not harder. Things are coming around. Staffing is still quite difficult. But we've been in this long enough now where we're landing on our feet and moving forward. And I think we're going to continue to ask the public for patience. Wait times are still longer. Hospitals still fill up. The people are not going anywhere. The hospitals are still full. But we are learning to manage them. And with some patience, I think we're going to get through this. And new graduates are coming. We just had a big lull there kind of in the middle of COVID. We lost a lot of people. To work for a lot, but there's renewed interest post-pandemic. So it's coming. We're getting there.
Have you seen the various bills that take on the healthcare issue that are making their way through the legislature? We got the grant program. You've got the grant program from hospitals, grant program for nurses.
Yes. All of that investment in healthcare is so needed and so appreciated. It really, we're not going to be anywhere when we can't take care of our citizens and get them proper health care, particularly post-COVID. So it's exciting, the things that are coming, and graduating more and training them here. It's wonderful.
Dr. Jennifer Bryan, the past Board of Trustees Chair for the Mississippi State Medical Association, has been our guest on Middays. Thanks for coming in, Doctor. Always good to see you.
Thank you for having me.
Coming right back. Half an hour left on the program. Stay with us.